Local anesthetics are widely used in dentistry to provide pain relief during various procedures. However, their use is not without risks. Complications can arise from the drugs themselves, the techniques used, or even from the equipment involved. In this video, we will explore the most common complications associated with local anesthetic use in dentistry, their causes, prevention strategies, and management options. Understanding these risks is crucial for dental professionals and patients alike, ensuring safer and more effective dental care. Let's begin by looking at how drugs and chemicals can impact oral tissues. One of the most common complications following local anesthetic administration is soft tissue injury. This often occurs when numbness leads to accidental biting of the lips or cheeks, especially in children, mentally challenged, or physically challenged adults. The lack of sensation makes it easy for patients to injure themselves without realizing it. Prevention involves educating parents or guardians to monitor patients after treatment and to avoid eating or chewing until sensation returns. If injury occurs, management is usually symptomatic, including analgesics, antibiotics if needed, and topical anesthetics or gels to relieve pain. Sloughing of oral tissues, which refers to the shedding or necrosis of the mucosa, is another complication. It is most commonly seen in the hard palate, particularly in areas supplied by the nasopalatine and greater palatine nerves. This is because the mucoperiosteum is tightly attached to the bone, making it more susceptible to ischemia. Prevention includes using local anesthetic agents with a short duration of action, administering the minimal effective dose, and warning patients against applying hot items to the area. Management is typically symptomatic and includes analgesics, topical anesthetics, and a bland diet. Most cases resolve within 1 to 2 weeks, but an established abscess may require incision and drainage. Necrosis or tissue death can occur at the site of local anesthetic injection, leading to painful ulceration. This is often related to the volume of solution injected, especially if administered over a prolonged period. The risk increases with excessive amounts or repeated injections in the same area. Prevention focuses on careful dosing and technique, as well as patient education. If necrosis develops, management is supportive, focusing on pain relief and monitoring for secondary infection. Complications can also arise from improper injection techniques. For example, the use of vasoconstrictors like epinephrine can result in tissue ischemia and necrosis if not administered correctly. Proper technique, knowledge of anatomy, and careful selection of agents are essential to minimize these risks. Dental professionals must be vigilant and adhere to best practices to avoid such adverse outcomes. Needle stick injuries are a significant concern in dental practice, often resulting from careless technique or improper handling of sharp instruments. These injuries pose a risk of transmitting infections such as hepatitis B. Prevention includes using the correct needle gauge, minimizing needle penetrations, and ensuring proper technique. Prophylactic vaccination against hepatitis B is recommended for all dental staff. If a needle stick injury occurs, the incident should be reported immediately, and post-exposure prophylaxis, PEP, should be initiated. Remaining calm and following established protocols is crucial for safety. A hematoma can develop when a blood vessel is nicked during the injection of a local anesthetic. This results in swelling, discoloration, and discomfort in the affected area. Prevention involves a thorough knowledge of anatomy, using short needles for certain nerve blocks, and minimizing the number of needle penetrations. If a hematoma occurs, immediate management includes observation, reassurance, and external ice application. Delayed care may involve analgesics, muscle relaxants, and, if necessary, antibiotics. Infection following local anesthetic administration can occur due to contamination of needles, passing through infected areas, or improper handling of equipment. Prevention is key and includes preparing the site before injection, using sterile and disposable needles, and avoiding multiple injections with the same needle. Proper surgical technique and knowledge of anatomy are also essential. If infection develops, management involves analgesics, antibiotics, physiotherapy, and other supportive measures as needed. A burning sensation during or after injection of local anesthetic can be alarming for patients. Causes include rapid injection, contaminated cartridges, high temperature of the solution, or altered pH. Prevention involves slow injection and storing cartridges at room temperature. Usually, no treatment is required as the sensation is transient and resolves on its own. Trismus, or restricted mouth opening, can result from trauma to muscles or blood vessels during injection, contamination of the anesthetic solution, or hemorrhage. Prevention includes using sharp, sterile, and disposable needles, proper handling, and avoiding multiple injections in the same area. Management is symptomatic and may involve physiotherapy, heat therapy, warm saline rinses, analgesics, and muscle relaxants. In severe cases, brisement force under sedation may be necessary. Edema, or swelling, can occur due to trauma during injection, allergic reactions, hemorrhage, or injection of irritating solutions. Prevention involves thorough preoperative assessment, careful handling of equipment, and using atraumatic techniques. If edema develops, it is important to identify the cause. Allergic reactions require antihistamines and possibly epinephrine, while breathing compromise necessitates basic life support. Referral to an oral and maxillofacial surgeon may be needed for severe cases. Blanching of the skin, or temporary whitening, can occur if a blood vessel is traumatized by the needle or if the anesthetic is inadvertently injected into a vessel. Prevention includes using aspiration techniques and avoiding intra-arterial administration. This phenomenon is usually transient and does not require treatment. Persistent paresthesia or anesthesia can result from injection near a nerve, contaminated anesthetic solution, trauma to the nerve sheath, or hemorrhage around the nerve. Prevention requires strict adherence to injection protocols and careful handling of cartridges. Management involves reassuring the patient, prescribing vitamin B1 and B2 tablets, and observing for up to 2 months. If there is no improvement, referral to a specialist is recommended. Facial nerve paresis or paralysis may occur if the local anesthetic is injected into the capsule or deeper lobe of the parotid gland. This results in unilateral loss of motor function, which is usually transient and lasts only a few hours. Prevention relies on a good understanding of anatomy and proper technique. If it occurs, explanation and reassurance to the patient are important. Persistent or prolonged pain after local anesthetic administration can be due to injection into the capsule or deeper lobe of the parotid gland, use of needles with barbs, or ischemic necrosis from excessive vasoconstrictors. Prevention includes using proper technique, avoiding subperiosteal injections, and using vasoconstrictors with maximum dilution. Management is typically symptomatic. Complications arising from drugs or chemicals used in local anesthesia are varied and can affect both soft and hard tissues. These may include tissue injury, necrosis, and allergic reactions. Understanding the pharmacology of anesthetic agents and their potential side effects is essential for safe practice. Dental professionals must always consider patient history and possible drug interactions before administration. Technique-related complications are often preventable with proper training and attention to detail. These include needle stick injuries, hematoma, trismus, and facial nerve paralysis. Adhering to established protocols, using the correct equipment, and maintaining a sterile environment are key to minimizing these risks. A thorough understanding of oral and maxillofacial anatomy is crucial for safe administration of local anesthetics. Knowledge of nerve locations, blood vessels, and tissue planes helps prevent complications such as hematoma, nerve injury, and inadvertent injection into sensitive areas. Continuous education and practice are vital for dental professionals. Maintaining sterility during local anesthetic administration is essential to prevent infections. This includes using disposable needles, avoiding contact with non-sterile surfaces, and preparing the injection site properly. Even minor lapses in technique can introduce bacteria and lead to serious complications. Educating patients and their caregivers is a critical part of preventing complications. This includes instructions on avoiding eating or chewing while numb, recognizing signs of infection or allergic reaction, and understanding the importance of follow-up care. Clear communication helps ensure patient safety and satisfaction. Vasoconstrictors like epinephrine are commonly added to local anesthetics to prolong their effect and reduce bleeding. However, excessive use or improper dilution can increase the risk of tissue ischemia and necrosis. Dental professionals must carefully calculate dosages and monitor for adverse reactions. Choosing the correct needle gauge and length is vital for minimizing complications. For example, a short needle is recommended for posterior, superior, alveolar nerve blocks to reduce the risk of hematoma and nerve injury. Using high-quality needles and avoiding barbed or damaged needles further enhances safety. Reducing the number of needle penetrations during a procedure lowers the risk of complications such as hematoma, infection, and nerve injury. Planning the injection path and using gentle, controlled movements are important steps in safe practice. If a needle stick injury occurs, it is important to remain calm and follow established protocols. The incident should be reported to the appropriate authority, and post-exposure prophylaxis, PEP, should be initiated if necessary. The needle should be removed carefully, and the area cleaned thoroughly. Referral to a specialist may be required for deep or retained needles. All dental staff should be vaccinated against hepatitis B and other relevant infectious diseases. This is a critical preventive measure, especially given the risk of needle stick injuries. Maintaining up-to-date vaccination records ensures a safer working environment for both staff and patients. Proper storage and handling of local anesthetic cartridges are essential to prevent contamination and ensure efficacy. Cartridges should be stored at room temperature and handled with clean, dry hands. Avoiding contact with non-sterile surfaces and using each cartridge only once reduces the risk of infection and adverse reactions. Using the aspiration technique before injecting local anesthetic helps prevent accidental intravascular administration. This simple step can reduce the risk of complications such as blanching of the skin, systemic toxicity, and tissue necrosis. Dental professionals should always aspirate before injecting. Allergic reactions to local anesthetics, though rare, can be life-threatening. Symptoms may include swelling, difficulty breathing, and rash. Immediate management involves administration of antihistamines, epinephrine, and corticosteroids as needed, along with basic life support if breathing is compromised. Early recognition and prompt action are crucial. Analgesics and antibiotics play a key role in managing complications such as soft tissue injury, infection, and hematoma. Analgesics help control pain, while antibiotics are used to prevent or treat infections. The choice of medication depends on the specific complication and patient needs. Many complications following local anesthetic administration are managed symptomatically. This means addressing the patient's symptoms with appropriate medications, reassurance, and supportive care. Most minor complications resolve on their own with time and do not require invasive interventions. Some complications, such as persistent paresthesia, severe infection, or deep needle injuries, may require referral to an oral and maxillofacial surgeon or other specialists. Early referral ensures timely and appropriate management, minimizing the risk of long-term consequences. Accurate documentation and prompt reporting of complications are essential for quality assurance and patient safety. This includes recording the nature of the complication, actions taken, and outcomes. Proper documentation also helps in identifying patterns and improving future practice. Ongoing education and training for dental professionals are vital for maintaining high standards of care and minimizing complications. Attending workshops, reviewing guidelines, and staying updated with the latest research help practitioners refine their skills and knowledge. Regular follow-up with patients after local anesthetic administration allows for early detection and management of complications. Patients should be encouraged to report any unusual symptoms, such as persistent numbness, swelling, or pain, so that timely intervention can be provided. Implementing a safe practice checklist can help dental professionals minimize the risk of complications. This includes verifying patient history, ensuring sterile equipment, using proper injection techniques, and providing clear post-procedure instructions. Checklists promote consistency and safety in clinical practice. Effective communication between dental professionals, patients, and caregivers is essential for preventing and managing complications. Clear explanations of procedures, risks, and aftercare instructions help set expectations and build trust. Dental clinics should be equipped and prepared to handle emergencies such as severe allergic reactions or airway compromise. Staff should be trained in basic life support and emergency protocols, and emergency medication should be readily available. To summarize, complications from local anesthetic use in dentistry include soft tissue injury, sloughing, necrosis, infection, hematoma, trismus, edema, blanching, persistent paresthesia, facial nerve paresis, and persistent pain. Each has specific causes, prevention strategies, and management protocols. Awareness and preparedness are the best defenses against these risks. Let's consider a case where a child bites their lip after dental anesthesia. The parent is advised to monitor the child and avoid giving solid foods until sensation returns. If injury occurs, topical anesthetics and analgesics are prescribed, and the area is kept clean. Most cases heal without complications, highlighting the importance of patient education. In another case, a patient develops swelling and bruising after a local anesthetic injection. The dentist reassures the patient, applies ice, and prescribes analgesics. The swelling subsides over a few days, demonstrating the effectiveness of prompt and appropriate management. A patient presents with pain and swelling a few days after dental anesthesia. Investigation reveals infection due to contaminated equipment. The dentist prescribes antibiotics and provides supportive care. The case underscores the importance of sterile technique and proper equipment handling. A patient experiences numbness lasting several weeks after a dental procedure. The dentist prescribes vitamin B supplements and monitors the patient. When symptoms persist, the patient is referred to a specialist. This case highlights the need for careful technique and timely referral. During a dental procedure, a patient develops swelling and difficulty breathing. The dental team quickly administers antihistamines and epinephrine and initiates basic life support. The patient is stabilized and referred for further care. This scenario emphasizes the importance of emergency preparedness. Dental professionals must be vigilant in preventing, recognizing, and managing complications related to local anesthetic use. Adhering to best practices, maintaining sterile technique, and educating patients are essential steps. With proper care, most complications can be avoided or managed effectively, ensuring safe and comfortable dental experiences. In conclusion, while local anesthetics are invaluable tools in dentistry, their use is not without risks. By understanding the potential complications, their causes, and management strategies, dental professionals can provide safer and more effective care. Continuous education, patient communication, and adherence to protocols are the cornerstones of safe dental practice. Thank you for joining us as we explored this important topic.